Welcome to the Holistic Therapy Interviews. Today I have with me Ben Calder, who is based in Wales with clinics in Shropshire and Cheshire. And Ben is an integral health practitioner. So welcome, Ben, and thank you so much for joining us today.
Hi, Lucy. Great to be here this morning. Thank you.
Fantastic. So I'm just going to give our listeners a little bit of background about yourself, and then I'm going to hand over to you. So as I said, Ben is an integral health practitioner, and his journey into the world of holistic therapy began about 30 years ago, using Qigong for himself. And then Ben went on to study NLP, kinesiology, Bowen, McLaughlin scar tissue therapy release, shadow work, and many more, too many to name here. And today, Ben is going to be focusing for us on Bowen Technique. So, Ben, I would love to hand over to you to share your journey and your pivot moments in your own words.
Thanks, Lucy. When you look back over 30 years, it's quite an amazing thing to realize that I've been doing so many things over all that time to work with my health. And I think it's one of the most important things for a lot of people to realize is that health is a process. It's not an event. It's not a miracle. It's not a magic bullet. We're going to work progressively over periods of time, and we're going to address different parts of ourselves as and how we need to. And as a young person, we had a very disrupted family life, I would say, when I was younger, and I was a very restless teenager. These days, I would no doubt be described as neurodiverse or ADHD if I was still in schooling, and I'm sure they would treat me accordingly. As a restless teenager, I was really grateful to find Qigong as a practice. I always think it's quite a funny story because I met a guy in his 70s called Ben, who taught me to basically stand still and how to use that as a way of starting to regulate myself. And that began my journey into Qigong and led on through. As I was away in university, I trained as a teacher there and realized afterwards, A, I didn't really know what I wanted to do in my life, and B, I health-wise, I wasn't as great as I could be. And by the time I finished university, I'd had trouble with alcohol and drugs and all sorts of stuff going on there. I got introduced to kinesiology in 1999. And it just made a phenomenal difference to my life immediately, and within 6 months, I was in such a different place to how I'd been in the previous years. And it's really funny as well because I really wanted to understand why I was getting improvements, and the lady who was treating me at the time wasn't the best at explaining things, so I didn't really understand why we were getting the results we were getting. So I put myself on a training course. And I found I had an aptitude for it. It came very naturally to me with the way that my brain architecture works, the pattern system within kinesiology, and looking for things that are resonant or dissonant within the body worked very well with my brain. But it was on my first training course that, I had problems with my back, I had flat feet, and one of the other candidates on the course said to me, "Oh, you got back problems. You ever had any Bowen technique before?" And I've never heard of that. What's that? And she said, "Well, at lunchtime, why don't you let me do your treatment and you can see how you feel?" And she noticed I'd got support insoles in my shoes to kind of boost the arches of my feet. She said, "You need to get rid of those. They're not actually helping. They're making your feet weaker. You need to learn to start using your feet properly." And she gave me a Bowen treatment, and I got off the couch after probably about 30, 40 minutes and kind of scratched my chin and could feel so much difference in my body. And in my mind, I went, have I started training in the wrong therapy here?
Oh, wow.
Which was kind of funny for me. And throughout my kinesiology training, I was receiving Bowen Technique sessions to support my musculoskeletal system, and trained and qualified in kinesiology. Took that up to quite an advanced level. I taught it for some years as well. And then I found space to come back and train in the Bowen. And in 2011, I then qualified in Bowen Technique, then continued to refine that process as well. So I've done a lot of training with different teachers in Bowen Technique and techniques that complement and add on to it, such as the McLaughlin scar tissue release that allows us to just stop the inhibiting action of certain scars, which can cause anything from pain and hypersensitivity through to numbness, restricted movement. So that it works as a really nice complement with Bowen Technique. Then I've just continued to build a practice over the last 20 years professionally. I've had my own clinic down in Shropshire for the last 10 years, and I love the work. I spend a lot of time going out to festivals over the summer where it's a bit of a kind of a working holiday, so that I'll do Bowen Technique for people during the day and give taster treatments. And I mean, we were at Russell Brand's Community Festival this summer, and I did 84 treatments in 3 days there with people, and saw a lot of bodies there, which I find really interesting for my practice. And then we get to enjoy the festival in the evenings and just hang out and be in nice outside spaces. So it's a really exciting and passionate space for me to be in, namely because I'm supporting people in making amazing transformations in their life, but just because it's so interesting and there's so many layers and so much depth there.
Yeah, so I have a couple of questions for you right off the bat. Do you find when you're giving the techniques and you're giving the therapy that it's energizing you, or you finding you're losing energy through that?
Definitely for me it's energizing, and I've said for years that by the end of the day I will usually feel better than I did at the start of the day. And part of that is because I've had good teachers, so they've been very clear about how we approach the work, both physically, psychologically, energetically. And also because of my Qigong training, I understand what to do with my posture so that I'm not moving in ways that are actually costing me energy. I can stand and move in ways that are at the very least neutral, so they're fairly kind of energy efficient, and in the best times I'm actually gaining energy as I'm doing that. So the practice itself, and it all depends, little things like at the height that you have the treatment table. If you've not got that adjusted properly, so in the clinics in Shropshire and Cheshire we've got electric tables, so I can get that adjustment just right for me, because again, you're working on a child, they're lower down, you're working on somebody who's bigger, they're higher up. For the most part I feel good at the end of the day.
And I thought you were going to say that, but I needed to ask. Now, having worked in a natural health centre for about 6 years when I lived in London, there was an osteopath who also did Bowen Technique.
Sure.
But I never knew what Bowen was. It was just one of those things that he did. I was like, I've got no idea. And I never asked.
Yeah.
So it's fantastic to have you on here. So I'm going to ask you, how does it work?
I mean, that is $1 million question. And just to simplify a little bit for people listening, if we think about chiropractic and osteopathic being manipulations, if we think about massage being a touch therapy where we're moving the tissue, Bowen Technique is neither of those things, but on some levels it's also both of those things. So we're a very light touch therapy, and in comparison to other techniques that work on the fascia, we're light touch rather than deep touch. And essentially, we're using a technique that's referred to as the Bowen move. So Tom Bowen, who developed this technique in Australia, he used to move his thumbs or his fingers in a particular rolling movement. And it's, for the most part, what we call a cross fiber move. So if you think about the fact that in your muscles, you've got length, so what we do with Bowen is we tend to move across them. So it's a little bit like strumming strings on an instrument. And because it's a light touch, that input is sending a signal in through the nervous system, through all of the connective tissue, starting from the skin, the superficial fascia, down towards the deep fascia and the muscle. It's also affecting the acupuncture meridians, because a lot of the key moves are also on key acupuncture points or aculines. So there's a very interesting correlation that we're working on these multiple systems, and the move puts a signal through that tissue. Now, because it's not a heavy or a painful movement, the body isn't having a reaction against it. So I don't know if you've ever had deep tissue massage done before, and like they're like, oh, and you can feel yourself kind of tensing and trying to, and from our point of view, that's counterproductive. What we want to do And the analogy I've given on many occasions is if I saw an elderly person wanting to cross the road, and I ran up and I grabbed their arm and I pulled them, the likelihood is they're going to resist. Whereas if I go up and I hold out my hand and I state an intention and say, would you like some support? They can choose, and then they're going to come with me. So by using these gentle inputs into the body, we're sending a signal that goes down into the tissue, but also moves along those lines of the muscle, of the connective tissue. And it's almost like the body, the nervous system goes into a self-inquiry. What's going on here? What's happening in these tissues? Are they how I need them to be? And because we typically will do both sides of the body as we do a sequence, that dialogue is then moving between different parts of the body. So and because it's not stressful, often the body is just resetting and putting back into default that which we've done the input on. So we can see a change, and most of the time we can palpate and feel those changes in real time within a few minutes. So, with good assessment in Bowen, we can actually see those changes taking place on the table immediately. And for the most part, you'll get up off the couch and you'll stand up and you'll have a little walk around the room and you'll know that things have changed. But it's a progressive action as well. So actually that integration and change will typically continue for anywhere up to 7 days after a treatment. So you can continue to improve as you go along. I've always said to people, the further away from me you walk after a treatment, the better you're going to feel, because it's just going to keep on walking as gravity and life then continue to repattern the system with that change that we've created.
Fantastic. So then, I mean, it sounds amazing, and I want to go and get a Bowen straight away. Where's my nearest practitioner?
Yeah.
But okay, so you're saying that can happen in the first session. Presumably, the number of sessions will depend on the depth of the problem. Ben, is that right? How does that work?
I mean, that's a nuanced question, because sometimes it's yes and sometimes it's no. I in my experience, just because a problem is, let's say, intense or it's been there for a long time, doesn't mean it's hard to solve. And sometimes the stuff that is small and niggly is sometimes the stuff that's more tricky. But again, typically with Bowen, what we recommend is that you have 3 treatments and that they're a week apart each. So that seems to be an optimum retreatment time. Although if there's really acute issues, we can treat more frequently than that. And with pregnant women, for example, we can treat you every day, because there's so much change taking place in the body that actually we can do those treatments regularly. But typically we say a week apart, 3 treatments. And normally by that 3rd treatment, both myself and the patient I'm working with, we know it's either making a significant impact or we're not getting to what we need to. So it's usually at that point, which is rare if we don't have a positive change, that I'll then be thinking, okay, well, what else are we not looking at here? What else is it? And this is where my kind of integral practice comes into it. But for the most part, then, if at 3 sessions we're not making a difference, we would possibly be looking to refer. Now, if in 3 treatments we are getting a significant improvement, but it's not cleared up as much as the patient's looking for, then it might be that we will do 4 or 5 or 6 sessions, but we might space those out further. So we might have 3, 4, 5, 6 weeks between those treatments, just to see how you go, see if we can also spot other patterns. Are there other things that you were doing fine and then you did this activity and that's when it changed again? So again, we're trying to review and look out for where the causes are within this as we go along.
Yeah, so I was going to say, do people have to have, because oftentimes it can be a bit of a lifestyle change as well. It's looking at what caused it, going to the cause. So would you send somebody home with exercises or things to do, things not to do particularly, or is that a by patient kind of
it's definitely by patient how we would frame any of that. But for example, we always encourage people to be well hydrated following the sessions. That really seems to help the integration of the work. We always encourage people to be gently walking about after the sessions as well. So it seems that walking as an input is really useful for that integration and stabilization of the work we've done. And we're not talking about massive hikes, but just 5, 10, 15, 20 minutes of walking about. But really, it's about not sitting down for too long, in the day or two following the treatment. Because again, we're resetting the connective tissue, we're resetting the way the body is. So if you then go and sit, your body's going to reset into a seated position. And, as I love to say, we become the thing we practice the most. So if you spend a lot of time sitting, you get great at sitting, but everything else is less easy.
Yeah, yes, absolutely. So it's allowing the therapy to land almost in your body rather than going back to an old pattern of, like you say, sitting down. Yeah. Okay. So and who would come to get Bowen? What might their challenges be? What age can they be? Those two things, Ben, if you can.
Sure. So let's start at the earliest possibility is pregnancy. So Bowen is an incredible therapy to use with pregnancy. It can really help to support both hormonally and structurally for women while they're pregnant, and just help to make, especially those lower back aches. John Wilkes, who's an amazing Bowen practitioner, has a site called Our Birth Journey, and they do a lot of work just really trying to optimize position for babies in the womb as well, to try and help childbirth be as easy as possible. Young babies, once they're 6 months old, or with consent through a doctor or a midwife, we work on young babies. So we get a lot of cases of baby colic, and this is often an issue around the diaphragm with the baby. And Bowen Technique, a lot of the time, one session, and those issues are solved.
Oh,
and
that
also
must be like magic for the mother as well as the
baby. Yeah, sure. Once they've had it seems it's funny, but whenever you deal with colic with babies, they either have like the craziest poo, the craziest sick, or a bit of both, and then they do really well. So yeah, once that bit's over, it can make a really big difference for parents as well as the babies. Also, if there's been intervention in the birth, so if we've had C-section, Von-2s, forceps, cords around the neck, if there's been any complications or difficulties in the birth, we can also help with the integration of that, so that the effects of that into the nervous system, which is a really strong imprint really at that first stage of life, those can be worked with to helpfully mitigate any adverse side effects from them. And then obviously we can work all the way through childhood for growing pains, if you like, sporting injuries, especially good with teenagers as well, because a lot of Bowen Technique works with the vagus nerve, which is our relax, restore, repair part of our parasympathetic nervous system. So it's really good with helping with kind of stress and tension within the body, breathing difficulties. We can work again hormonally, so women that are having menstrual difficulties, Bowen can be very useful for that as well.
And at the other end, so menopausal women.
Yeah, absolutely. Same stuff. And then also, as we get older, basically any injury, trauma, fall, when the body's out of alignment. And as we get older as well, just keeping the mobility into the body and keeping the body soft and fluid and aligned so it moves better. And I used to have a colleague, an Alexander teacher, who many years ago said to me, and I've used this ever since, he said, there's no real diseases of old age, there's only diseases of extended bad habit. So part of what we want to do with people as they age is actually keep the habits of movement and lifestyle as well as they can be, so that actually they're thinking about having, it's like servicing your vehicle before you go on a long journey. You put the time and the energy in to do something constructive so you get the best result out. One of my favorite stories came from Julian Baker, who used to be the head of the College of Bowen Studies here in the UK. He's just stepped back from that recently, but he talked about a client in her 80s who he treated for maintenance. And again, I have clients that come in on a regular basis just to keep themselves well. And he'd had a lady in her 80s who'd had a fall, and rather than going to the doctor, she'd come to see Julian, and he did a treatment for her, and he said, look, I really want you to just go and get this checked anyway, just because of your age. Let's just make sure there isn't any kind of hairline fracture or anything like that. So she did go to the doctors, had an x-ray, there was no sign of the break, and she was moving nicely after the Bowen. But the doctor said to her, I want to talk to you about how you're managing your pain. And she said, what pain? And he said, the pain of the osteoporosis in your hip. And she said, what osteoporosis in my hip? Because she'd been having this regular work done and it just hadn't impacted on her body. because she was just dealing with it. So there's all sorts of cases of things like that where Bowen is just supporting the body, and it's beautiful in that way.
So if somebody, I could talk to you for hours, Ben. If somebody has been that person who's sitting behind the desk, who's not been eating well, who's put on a ton of weight, who has now got heart difficulties and that difficulties and maybe arthritis, and that's been long term all the way through their life, they can still come and see you and get help, right?
Absolutely. And, especially from the integral perspective that I look at things from, there's never a point where you can't make a positive change. I don't care how late it is in your life, how long the problem's been there, how serious it seems, there are always things that you can do to make adjustment. And we've just got to start treating ourselves a little bit more kindly and a bit more lovingly, and, care for ourselves. If somebody gave you like a McLaren race car and said to you, this is the only vehicle that you can ever have again in your life, and in fact, you can't leave your house unless you're in this vehicle, you wouldn't be sticking Asda fuel in it. You wouldn't be sticking cheap parts in it. You wouldn't be skipping on the servicing, and you would learn to become a better driver. Now, if you see your body as that McLaren race car, you can never have another one. It's worth a fortune. And the only way to maintain it is to look after it properly. We can actually get a much better outcome from our bodies if we just understand that relationship between the body, the mind, our culture, and our relationships with the world, our environment. And we can make that difference that we don't have to suffer. We can actually just prepare to be well and do the things that need to be done.
Yeah, all the way through our lives, as long as we take responsibility for that McLaren racing car.
Yeah, absolutely.
Right? You for yours, me for mine,
Exactly.
and our listeners for their own. Fantastic. Right, we are going to come to our last question now. So what I would like to ask you, Ben, before I just do a quick overview of what you've spoken about, is what would your top 3 tips be for our listeners? So if you can have a think on that one.
Yeah.
And I'm just going to quickly share Bowen Technique. It sounds amazing, and I'm definitely going to go and have a practitioner practice on me and get some of that therapy. But it is for any age, from pregnancy right through to old age, whether you've just got something niggly or whether you've had something really long term. It's super gentle on your body, but it has amazing, even after one treatment, you can feel the difference. And Ben is actually going to talk right at the very end about how you can integrate things along with Bowen, because Ben, as I said at the beginning, is an integral health practitioner. But coming back to you, Ben, can you give your 3 top tips for our listeners, please?
Yeah. So the first thing, and it's the most obvious thing, is breathe. You wouldn't believe how much good breathing can A, reduce all-cause mortality, but B, how much it helps us to regulate and center ourselves. So breathing is the top tip. Before you do anything else, whenever something isn't right, check how you're breathing and learn to do good breathing, good nostril breathing. The second would be care for your vagus nerve. So this is our relax, restore, repair system. So you want to make sure that you're not overstimulating yourself, relaxation. Things like singing and humming really help with that. Cold showers help with that. Good breathing helps with that. So the more that we can regulate our vagus nerve, our heart, our lungs, our digestive function, immune system, reproductive systems, they all work better when we've got good vagal tone. And the last top tip would be less social media.
Oh, yes.
The less time you spend in the little black mirror and the more time you spend out in the real world with real people, nature, stuff, the healthier life is.
Oh, yeah, most definitely. Okay, thank you so much, Ben. We're going to put Ben's website below. So if you are lucky enough to live near Ben, who's, as I said, in North Wales and has clinics in Shropshire and in Cheshire, then do take a look at the website. But just at the very last thing, I know you want to share, Ben, what the integral part of your therapy is.
Yeah, sure. And also, just for anybody that isn't near me, you can go to bowentherapy.org.uk. That's bowentherapy.org.uk, and there's a national register there. That's the Bowen Therapists Professional Association, of which I'm on the committee there as well. So if you want to find Bowen anywhere else, that's where to go. But for people listening, you've obviously heard my way of thinking around health is quite complex, because life is. And in integral theory, we look at 4 dimensions of being, which is our mind, our thoughts, our beliefs, our body, its behavior, nutrition, movement, our culture, which also includes our relationships, and our environment, the physical space that we live in. So if you and I were in Barbados right now, it would be, different culture, different environment, different mindset, different behavior. So all of these things interact with each other, and we can never reduce our experience of life to less than those 4 aspects. So within integral practice, I'm always thinking about, in what areas is this person needing to improve health? And they all impact on each other. So, for example, if you're living in a moldy house, it's going to affect all the other parts of your life. If you are living in a toxic culture, it's going to affect all the other parts of your life. If you've got unhealthy belief systems, it's going to affect all the other parts of your health. If you've got bad eating habits and bad movement habits, it's going to affect all the other parts. So as an integral practitioner, this is where I use my kinesiology as a way to work out what area we address. So in this, we might do psychological work, we might do shadow work, we might do Bowen, we might do allergy work, we might do a whole mixture of stuff, but we're coming up with this bespoke pattern for each individual within integral practice. And for me, it's the medicine of the future, and functional medicine practitioners are much more heading that way. I think there's a much better understanding of mind-body, but that we also have to embed in culture and environment. So we're getting towards this point, but for me, it's critical. If we don't look at all of these things, it's good to have specialism, but we also need to understand the bigger picture.
Yeah, we're looking holistic here, really, truly holistic, which I absolutely love. And I that's the way that I work as a holistic flow coach. So definitely fantastic. I absolutely love all of that, Ben. It's been wonderful having you here. And I'm sure our listeners really understand and have got a ton from all that you've said. Our next interview is going to be coming up on screen now. So if that's something you'd like to find out more about, then hop over there and I'll see you on that one. Take care and bye for now.
See you.